My name is Lori Logan, and I'm a genetic counselor and manager at Desert Perinatal Associates. In this educational video, we will overview your genetic screening and diagnostic testing options for chromosome disorders and certain birth defects. We will also discuss carrier testing for parents. You can follow along on your consent form as we review these options. In the first segment of the video, I will discuss screening for chromosome disorders such as Down syndrome and for certain birth defects such as spina bifida. There are various types of screening and testing for chromosome disorders. This slide shows a timeline for the different options. Ultrasound screening is recommended for all pregnant women, as is blood screening for spina bifida, also known as a neural tube defect. A nuchal translucency ultrasound that measures a small amount of fluid at the back of the baby's neck is completed between 11 weeks 0 days and 13 weeks 6 days. This is a non-invasive screening for chromosome disorders, congenital heart defects, and certain other genetic conditions. A detailed anatomy ultrasound between 16 to 20 weeks is also recommended for all pregnant women, and this will be scheduled with us here at Desert Perinatal Associates. Blood screening for spina bifida is also recommended for all pregnant women and is done through measurement of alpha-fetoprotein, also known as AFP. This is completed between 15 weeks 0 days and 21 weeks 6 days. Women who have the diagnostic test known as amniocentesis do not need to complete this blood screening, as alpha-fetoprotein is measured in the amniotic fluid. The blood screening commonly offered to low-risk pregnant women at Desert Perinatal Associates is known as sequential screening. Low risk refers to women under age 35 at their due date and those with normal reassuring ultrasound findings, as well as those who do not have a child or previous pregnancy diagnosed with a chromosome disorder. Sequential screening involves 2 blood draws. The first is completed between 11 weeks 0 days and 13 weeks 6 days. By combining 2 pregnancy protein levels in the maternal blood with the nuchal translucency ultrasound measurement and the mother's age, preliminary risk estimates, or ratios, are given for the odds of Down syndrome and trisomy 18, a rare and very serious chromosome disorder. Final estimates are given after the second blood draw, which measures 4 protein levels and occurs between 15 weeks 0 days and 21 weeks 6 days. Risk estimation for spina bifida is also provided with Part 2 results. About 5% of women will receive at-risk results. Most of these are false positives, meaning that the baby does not have the chromosome disorder. For every 10 women who are actually carrying a baby with Down syndrome, about 9.5 will be identified as increased risk. Next, we will discuss a blood screening option generally offered to higher-risk pregnant women, known as cell-free DNA or non-invasive pregnancy screening. This is often referred to as NIPS or NIPT. This test looks for fetal DNA in the maternal blood. Cell-free DNA screening reports as positive or negative and has a high degree of sensitivity and a low false positive or low false alarm rate. Cell-free DNA also screens for sex chromosome number problems and is able to identify the sex of the baby. It can be completed as early as 10 to 11 weeks. It is important to know that this screening may not be covered by insurance for low-risk pregnant women. Therefore, you need to be proactive in finding out in advance.
Hello, my name is Ruth Ann Denchia, another of the Desert Perinatal Associates, or DPA Genetic Counselors. I'll be discussing prenatal diagnostic options, including amniocentesis and chorionic villus sampling. As you have learned from the previous section of this video, screening tests are designed to identify patients who are at an increased risk of a genetic disorder. While they are very helpful in the care and management of our patients, they cannot definitively predict if a baby will be affected with a condition. The following section reviews diagnostic testing options. These procedures are routinely offered to patients of advanced maternal age, which is defined as women who are 35 years or older at time of delivery, patients with positive screening results, patients with abnormal ultrasound or sonogram findings, patients with a family history of genetic disorder, and patients who have previously had a child with genetic disorders. Prenatal diagnostic options are available in the first and second trimesters. Please remember these procedures are voluntary evaluations and are available to patients who wish to have the most comprehensive level of genetic testing in their pregnancies. Chorionic villus sampling, otherwise known as CVS, involves taking a small tissue sample or biopsy of the developing placenta. CVS is used to diagnose or rule out chromosomal or genetic disorders in the first trimester. The test is generally performed between 10 and 13 weeks in pregnancy. There are two ways a CVS can be performed. A transcervical procedure is performed by placing a speculum in the vagina as if a pap smear were to be performed. A thin tube is then passed through the cervix of the womb to reach the placental tissue. A transabdominal procedure is performed by passing a thin needle through the woman's abdominal wall and into the uterus. Tissue is then removed from the fringe of the placenta. As this is an invasive procedure, complications following this testing may include cramping, bleeding, or infection. Some complications could lead to miscarriage, which may happen in about 0.5% to 1% of all procedures. There is also a 1% risk of unclear results, which would require further assessment. Additionally, for patients who have a CVS, it is recommended that a blood test called the MSAFP be performed in the second trimester. This is a screening tool to assess the risk of birth defects of the spine. Amniocentesis is a more commonly known diagnostic test. This procedure removes a small amount of the amniotic fluid that surrounds the developing baby in the uterus. A long, thin needle is inserted through the mother's abdominal wall and uterine wall. This is performed under ultrasound guidance, and a pocket of fluid as far from the baby is sampled. About 2 tablespoons of fluid is removed, and the needle is withdrawn. The whole procedure takes just a few minutes. This invasive procedure also has some risk of complication. These are rare and could include bleeding, leakage of amniotic fluid, and infection. Pregnancy loss from the procedure could occur in approximately 1 in every 1,000 tests performed. The decision to have either a CVS or an amniocentesis is a personal one and should be based on your own beliefs and concerns. The doctors and genetic counselors at Perinatal Associates can help answer any further questions you may have about these tests.
My name is Tracy Schultz. I'm a certified genetic counselor at Desert Perinatal Associates. I will take a few minutes to talk to you about genetic carrier screening as part of preparing for your family. You can think of carrier screening the same way that you think of an X-ray. An X-ray allows you to take a closer look inside your body. A carrier screen allows us to take a closer look inside of your cells at your DNA. DNA is the information that makes each of us different. By studying pieces of your DNA, called your genes, we can tell you the chance of having a child with a serious health issue. Most of the time, we will find that the chance is low. If the chance is increased, then it is important to understand that there are many ways to use this information. Genetic carrier screens are available and can detect conditions that can be passed from a parent to a child. The impact of some conditions can be reduced if treatment is started early in life. Some conditions, such as cystic fibrosis, cause lifelong symptoms and reduce lifespan. Some of the conditions have limited or no treatment available, like spinal muscular atrophy. You can view a website to obtain a list of diseases that will be evaluated in a genetic carrier screen. Many of us with no family history of genetic diseases can still be carriers, and we are simply unaware of it. Over 80% of children with genetic diseases are born to parents with no known family history. A positive test result means that you are a carrier. Genes are inherited in pairs. You receive 1 copy from your mother and 1 copy from your father. A carrier is someone who has 1 gene with a change and 1 gene that is working. As long as 1 gene in the pair can do its job, carriers are healthy and will not be aware of the gene change in their body. Most diseases in a carrier screen are the result of both parents being carriers of the same disease gene. This means that both parents would need to be carriers of the same disease in order to have an increased chance of having a child affected with a disease. Less than 5% of men and women who undergo carrier screening end up being positive for the same disease as their partners. If you and your partner are found to be positive for the same disease, there is a 1 out of 4 or 25% chance of having a child with that disease. When your results come back, we will review your carrier status and disease modes of inheritance in detail with you. If a carrier screen shows that you are at an increased risk of having a child with a disease, it is important to be aware that you have options. You can request to sit down with a genetic counselor at our practice to guide you through your options. Carrier screens reduce but do not eliminate the chance of having a child with a health condition.
A last note about cost. If your insurance requires pre-authorization for cell-free DNA screening, we will request it. Otherwise, we will not. Pre-authorization will not be obtained for carrier testing. Please be proactive in contacting the laboratories that provide these screenings and testing to learn more about possible out-of-pocket expenses. Thank you for listening, and feel free to fill out your consent form, which you can give to the DPA staff. Let us know if you have additional questions or would like brochures further describing these options.